Hi, I'm here this evening to talk about a very simple difference that each of us can make that I think will change the future. The concept of neurodiversity might have been bandied about in conversation lately, but I just wanted to explore a little bit more into detail into what it actually might mean in practice for us. Okay, so just a short note on the use of my language during this presentation this evening. So, in a number of studies and surveys, it's been demonstrated that there is a wide preference towards the use of identity first language. So, that would mean a preference for the use of the term autistic people or autistic person. And that might be the first time that that's ever been presented to some people listening in. So, I have compiled some compelling arguments that demonstrates that the preference comes from the members of the autistic community themselves. So, the examples that I give are coming from Dr. Nick Walker. So perhaps you were taught or introduced to the notion of person first language or the use of the term person with autism. And it might now seem a bit disrespectful to consider the term autistic person. Maybe it might seem to separate the person from the autism. But autism doesn't exist separately from autistic people. It's not actually a thing that a person can have. It's not like a disease or a tumor or a virus. You can't cut autism out of a person, put it in a bottle, nor can you isolate autism in a lab or have a little Tetri tube full of autism. Being autistic informs every facet of a person's development, embodiment, cognition, and experience in ways that are pervasive and inseparable from the person's overall well-being. So the autistic person can't be separated from the autism, nor can the autism be separated from the autistic person. Another concern that people might raise is that they prefer the use of person first language themselves, as it seems to somehow put the person first. So, as if the autism isn't defining a person. But people who are fluent in the English language implicitly understands that a noun is primary regardless of where it's placed in relation to any adjective. So it's understood that adjectives placed before the noun just serve to provide more information about the noun. So say when reading about a blue Norwegian parrot, for instance, everyone can understand that it's first and foremost a parrot, and that the colour and nationality are secondary to its parrotness. Everyone can also understand that adjectives aren't exclusive. So in other words, the presence of any given adjective before a noun doesn't imply that it's the only adjective, and therefore entirely and exclusively defined by that noun. When referring to the parrot as a blue parrot, everyone can understand it's not in any way implying that a parrot is entirely and exclusively defined by its blueness. Everyone can understand that the parrot can be blue, Norwegian, male, large, resting, hungry, and all other manner of things at the same time. But most importantly, in the argument for the use of the identity first language, is that the person first language may have been the teaching many years ago, but it wasn't representative of the voice of the autistic person. Now, that's not to say that every autistic person prefers identity first. So if there's ever a doubt, it's always best practice to just ask a person how they would like to be referred to. So let's get into it. The question of what is autism is one that is going to perpetuate within this narrative of moving into a more acceptance framework of autism. So without giving too much away, I'm just going to ask one question of you all this evening. And by virtue of your attendance at this webinar, I can safely assume that there's an active interest in the topic. So I'll ask, what would indicate to you that a person is autistic? Just take a minute to write in your responses. Luckily, I won't call on anyone to read out their answers, but I'm going to assume that some answers or elements might have similarity to the DSM definition, which includes a history of restricted, repetitive, or stereotypical behaviour, interests associated with difficulties, with flexibility, and maybe a preference for predictability or routine. You might have written something about a sensory difference, or maybe difficulties with social relationship or communication. And if you did have elements of that in your answer, you wouldn't be alone. They're commonly noted answers to that question. So there's a number of perspectives on autism, including psychiatric, biological, and philosophical questions to consider when you think about what is autism, as well as the meaning to those who experience it, those who diagnose it, and to those who research it. So what we learn is that autism is a polysymous concept. That just indicates that there's several meanings. And without an agreed definition, we have to have a modern ethical analysis of the approaches and beliefs that we use to understand autism. So in other words, the way you think about autism becomes your definition, which determines your approach and behaviour. So let's just look at an example of this. If you believe that autism is rooted in a biological foundation, such as the speculation that, say, gut bacteria can cause autism, you might be more likely to adapt a diet modification or a similar approach. Or if you believe autism as having a behavioural root, you might be more inclined towards ABA or those behavioural conformative therapies. Or if you consider autism to be just a different brain development, then their different perceptual experience, your behaviour might be more aligned to an acceptance approach. And in the scientific and research world, each of these approaches and many, many more continue to dominate the modern published literature on autism. But we have to question ethically, is it doing anything to positively contribute further to understanding? So, beyond those that are involved in the very scientific analysis of autism, we must therefore look at how our approach to autism is shaped by the notion of how we think. Or to put it more simply, how you think or your beliefs has an immediate and unconscious impact on what you do or your actions, which in turn has a direct consequence on what you get or your outcomes. Or to be more specific, more likelihood is that it has an actual impact on the autistic person that you're engaging with. So your beliefs impact your actions and impact the outcome for the person. And any behaviour change can only take place in a conversation by first considering conscious actions to adapt these beliefs. So let's have a look at the current societal view of autism, and maybe a more global and pervasive opinion, which is rooted in the idea that there's a right form of functioning, and anything that diverges away from that must therefore be a deficit, a damage, or a disorder. And the current view proposes that any traits or needs attributed exclusively to a defect of an individual are incompatible with any natural order, and therefore a personal deficiency that the person must be cured or fixed. But that's difficult to digest, though it's reflective of the way our systems of society are made up of. And at the root of that is the attitudes and beliefs of the vast majority of people who live in this society. So taking the point further, we can look at this as a pathological viewpoint and the impact that it's having on the autistic people and our society as a whole. So the theory of autism as a form of a psychiatric disturbance has linked autism with societal shame and moral judgment. The theory of autism as being caused by a poor emotional attachment with a mother or a refrigerator mother has caused undue parental distress and shame, or the unfounded link between vaccinations and autism remains a factor influencing parents to opt out of vital vaccinations for their children. And most recently, the notion that social skills will cure autism has created a presentation of trauma and anxiety in autistic adults. So, despite the pathological paradigm of autism being widely disregarded by autistic people and advocates, we can see the negative societal impact that its history has had. So despite these theories having been widely disregarded and ultimately dispelled by the scientific community, the impact remains far-reaching, and it doesn't contribute to a very positive outlook for the future. And so if we don't all engage now to alter the course, I suppose, which has caused us to look around for a more productive belief system for society. So in recent years, autistic advocates have called for a more positive, humanising, identity-first language when describing autism. So rejecting negative language such as disorder, deficit, impairment, and move to describe autism as just a way of being, a part of one's personal identity which does not need to be cured. Promoting being autistic as a difference, not a disadvantage. And that's not to suggest that autistic people or those with any other diagnosis don't find life challenging, but that they see it as a different way of communicating, thinking. And the neurodiversity movement is proposed as the future to shape beliefs about autism and in turn create a more embracing and accepting society for autistic people. So the neurodiversity movement calls for a no-cure approach to autism, which should not be considered as a disability, but just a neurological form within a diversity of human minds. And it's been argued that that shift of emphasis to considering autism as different rather than deficient cognitive style could mean the difference between whether a diagnosis of autism is received as a tragedy or whether it's received as interesting information, much like being told that a child is left-handed. And if society was more adaptive to individual needs, huge barriers preventing autistic people from accessing this would be torn down. So fundamentally, at its core, the neurodiversity movement is aligned to human rights. First and foremost, autistic individuals are human. And like all humans, regardless of their support needs or communication style, individual independence, everyone is entitled to the same human rights. And that's core to the concept of neurodiversity: respect, dignity, and acceptance. Therefore, the future will depend on changing the collective belief system on what autism is, on whether we continue to follow history with a pathological approach to autism, one with negative terminology, poor predicted outcomes, and further segregation, where we perpetuate the perception that people with disabilities are just subject to unfortunate circumstances and that they must depend on others for help and should forego some autonomy in selecting their own life course. And we can see that that's deeply humanising and might evoke unwanted pity. Or we could instead emphasise a more socially inclusive view of disability, one that asserts that the extent to which a person is disabled is not entirely due to any condition or label or diagnosis, but it's in part created by the way that society responds, or more likely fails to respond, to anyone's particular needs. So in Gheel, we encourage everyone to embrace the idea of a no cure or no treatment concept, and to reject any negativity that might typically surround those that live, learn, and experience the world in a particular way that's often perceived as different. So we believe that every autistic individual should be seen for their passions, their strengths, and their talents, not defined by their differences. And we don't use the notion of defects, which is just a socially constructed concept, which is rooted in the idea of there being a right and wrong way of being. And that we recognise being autistic is just who the person is, and endeavour to learn and build a relationship with the person using an inside-out approach, which is very simply just seeing the person as a human and understanding the needs presenting, as opposed to applying some educational understanding of autism to the individual's needs and personality. So we don't use the concept or terminology of high functioning or low functioning. Compartmentalising somebody as high functioning autistic diminishes the effort that they expend to ensure that they conform to society's expectation of normal or of being. And consigning an individual to low functioning diminishes their humanity, their dignity, and their strengths, and ultimately gives this tacit approval for those around them to succumb to the curse of the low expectations for them. Function, kind of like what we now know and accept about consent, is not a linear process. It's not a matter of high or low, much like consent is not a case of yes or no. And the autistic people supported in Gheel have specific needs, not just by virtue of having a diagnosis of autism. So we exist to understand and support those needs within an autism-informed framework for response. Needs are not static, and we must ensure that they're kept to the fore of support provision. We have to listen to the individual, keeping the voice to the fore of their support. So in practical terms, on the start of this process of changing our beliefs about what autism is, we can do two very tangible, simple yet effective things. So the first is to create a renewed focus on what connects us all together: the pursuit of happiness. And all the research and all the information about how different and specific and unique autism is has sometimes made us forget that autistic people are not just different, but that they share the same expectations in life, especially when it comes to the basic needs such as happiness. All of the outcome and effect studies, for instance, rarely take emotional well-being as a desirable outcome. So when the focus is on well-being, it's often from a very negative perspective, such as the lack of well-being or quality of life for an autistic person. And much like our understanding of how health has evolved to mean much more than just free from disease, our understanding of happiness has to be much more than just free of distress, or worse, the terminology such as neutral or baseline. So it's important to continue to ask what makes us all happy. It's time to take a U-turn in the approach and the change from that exclusive focus on what makes autism so different and so negative or clinical medical approach of happiness to just look at a shared and positive view focus. After all, we just all want to be happy. So the second very simple and effective thing that we can do to start to change our belief system about autism is to be more considerate about communication. So when we speak about autism, language matters, words matter. Autism is not a deficit, it's not a defect, it's not a disorder, it's not an illness, it does not have symptomology or severity. You cannot cure nor treat it. Autistic individuals don't suffer from their autism. And it requires some conscious thought at the beginning. Though, if you truly believe in the idea of autism as just being a form of neurological diversity within human minds, the change will soon become ingrained in your thought process. Communication by its very nature is reciprocal. There's often an expectation that autistic individuals should learn how to communicate with non-autistic individuals. But that reciprocity implies that non-autistic individuals have as much responsibility to learn how to communicate with an autistic individual and vice versa. So many autistic individuals experience receptive or expressive language differences. And these differences may mean the way that an autistic person processes communication, and that the way that they communicate with you might be unusual for you or unexpected sometimes. And one of the best ways to accommodate such communication differences is to just be patient, to give the person the time and the space to process your words and to prepare their response. And most importantly, listening to the autistic voice, whether those voices communicate traditionally or not, is the key to accessing the internal world of the people whom you might interact with. And that's truly to respect the person. So communication differences can be frustrating on both sides. So acknowledging that people have different ways of revealing their message, and that the other needs to adapt their receiving or their listening to that message, is key to a mutual understanding. So communication frustration might also be referred to as challenging behaviour. So in this case, it's just important to remember that the person has a problem and not that the person is a problem. So the next time you're asked, what would indicate to you that a person is autistic? Perhaps you might have a different belief. Perhaps you might not consider repetitive, restrictive, or stereotyped behaviour, but rather you might see as a person as being passionate, dedicated, or having a talent to focus on a smaller range of interests with huge insight, or maybe an expert understanding. You might not see difficulties with flexibilities or predictability or routine as being a negative. You might see or respect that a person has a desire to be informed, or that they're dependable. And you might not say that they have sensory issues, but that they experience the world differently, or might have excellent attention to very minute detail. And finally, we might consider the role that we have to play in ensuring that difficulties in social relationships and communication are not one-sided. We might consider that the person has difficulties in being understood. Let's reflect. The way you think about autism becomes your definition, which determines your approach and in turn impacts the outcome for the future of the autistic person. The way that you speak about autism is a direct reflection on what you believe about autism. So let's just make a move towards a more neurodiversity affirmative language. And nobody should be seen as a product of their difference. So let's focus on ensuring that needs are met in order to be able to support people with the commonalities of all: quality of life, happiness, and meaning. And fundamentally, we are all human with needs, wants, rights, and desires. And if you wouldn't accept it for yourself, why accept it for another? So there's a key underlying message. Did you catch it? The physical world is built for the majority, and this will continue to create barriers for autistic people to overcome. However, there's an ability at this point to ensure that the social world might be a little bit more accepting. Small individual changes that each of us can make, like the move from being hyper aware of difference to just being hyper acceptance of it, and a truthful reflection on our beliefs about autism, will make sure that the future is much more positive for autistic people. And if we can redefine autism like that, I think we can change everything. And it's a simple idea, but I don't think it's a small one. Thank you so much for listening.